BCEN Test Prep Exam Audiobook. Question 1. The most common cause of lower gastrointestinal bleeding in adults is Option A. Gastric ulcer. Option B. Diverticulosis. Option C. Esophageal varices. Option D. Mallory-Weiss. The correct answer is option B. Diverticulosis. Question 2. A patient presents with sudden onset worst headache of my life. The nurse's first priority is Option A. Administer pain medication. Option B. Perform a complete neurological assessment. Option C. Prepare for lumbar puncture. Option D. Obtain a non-contrast CT scan of the head. The correct answer is option D. Obtain a non-contrast CT scan of the head. Question 3. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects Option A. Acute myocardial infarction. Option B. Thoracic aortic dissection. Option C. Pulmonary embolism. Option D. Tension pneumothorax. The correct answer is option B. Thoracic aortic dissection. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Priapism is a urological emergency characterized by Option A. Painful, prolonged erection. Option B. Inability to void. Option C. Testicular torsion. Option D. Scrotal edema. The correct answer is option A. Painful, prolonged erection. Question 5. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is Option A. Obtain a stat chest X-ray. Option B. A needle decompression at the right second intercostal space. Option C. Administer albuterol nebulizer. Option D. Prepare for intubation. The correct answer is option B. Needle decompression at the right second intercostal space. Question 6. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A. Pain medication. Option B. Intravenous fluids only. Option C. Immediate endotracheal intubation. Option D. A neurological reassessment in 15 minutes. The correct answer is option C. Immediate endotracheal intubation. Question 7. A patient leaving against medical advice, AMA, must be informed of Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. Question 8. Murphy's sign is used to assess for Option A. Pancreatitis. Option B. Acute cholecystitis. Option C. Diverticulitis. Option D. Small bowel obstruction. The correct answer is option B. Acute cholecystitis. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. The most effective method to control severe bleeding from an extremity wound is Option A. Elevation. Option B. Direct pressure. Option C. Pressure point compression. Option D. Ice application. The correct answer is option B. Direct pressure. Question 10. The hallmark sign of compartment syndrome is Option A. Pain relieved by elevation. Option B. Pain out of proportion to the injury. Option C. Absent pulse in the affected extremity. Option D. Pitting edema. The correct answer is option B. Pain out of proportion to the injury. Question 11. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects Option A, open minus angle glaucoma. Option B, acute angle minus closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle minus closure glaucoma. Question 12. The most common cause of airway obstruction in an unconscious patient is option A, laryngospasm. Option B, foreign body aspiration. Option C, the tongue. Option D, mucosal edema. The correct answer is option C, the tongue. Question 13. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of option A, hemorrhagic shock. Option B, cardiogenic shock. Option C, neurogenic shock. Option D, septic shock. The correct answer is option C, neurogenic shock. Question 14. The best method to remove a prosthetic eye in an emergency is option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 15. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Question 16. Ovarian torsion presents with option A, bilateral lower quadrant pain. Option B, a sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, a fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Question 17. Meningitis is an inflammation of the option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, a ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 18. What is the priority intervention for a patient with an open fracture? Option A, immediate surgical debridement. Option B, apply traction. Option C, cover the wound with a sterile saline minus moisten dressing and immobilize. Option D, administer analgesics. The correct answer is option C, cover the wound with a sterile saline minus moisten dressing and immobilize. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B, hypothermia decreases metabolic demand and provides neuroprotection. Question 20. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates option A, normal cellular metabolism. Option B, hypoperfusion and anaerobic metabolism. Option C, kidney failure. Option D, liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. Question 21. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 22. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B. Hypotension, muffled heart sounds, distended neck veins. Question 23. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. Question 24. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 25. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN.